Or- Hello. Hi.
Hi.
Hello, everyone, and welcome to this very interesting session on eye health with Dr. Archana Kulkarni Pimpalnerkar. Archana is a very dear friend, and we've been together since medical school, where we used to study together. We even shared a room in the hostel, and it is some really wonderful memories I've had with Archana over the years. And we always get together when I visit the UK. Archana is a consultant ophthalmologist at South Warwickshire Hospitals NHS Trust and is also an honorary consultant at the Birmingham Children's Hospital. And we're going to talk about eye health as we age. I initially approached Archana because I noticed that a lot of women go through difficulties with their eyes as they go through menopause, not just with getting glasses, but other problems as well. And we were having a chat one day, and I said to Archana, why don't you come and have a conversation about this, especially about menopause, because obviously I'm interested in menopause. And she says, well, why restricted to menopause? Let's just talk about how the eyes change as we age and over a period of time. So, welcome, Archana. Thank you so much for agreeing to come and talk to all of us about eye health.
Thank you, Nilima, for this lovely, kind invitation. I'm really excited, and I hope it's an interesting discussion.
So, what's you started a new initiative in 2021 with eye health for people. Can you tell us a little bit about that?
So this is Sight and Beyond, and the idea came up with the fact that I was working with children with visual impairment, and in the the current age of IT and computers, it was a way of trying to bring some sort of hope to these children, and then using all the different apps, the free apps available, free downloads available to help them actually see. So that's why it's called Sight and Beyond. So in addition, it's also there to sort of be a sort of a support or an information gathering opportunity where we can give free information to different people with vision problems. So
Hmm.
that's the initiative.
Cool, cool. That's nice. Just referring to my sheet. So, what is so unique about the eye and aging? And I mean, most of us, people like me, we're only concerned about, oh, we're going to need to wear glasses, or my eyes feel really dry and itchy. And every little they become a lot more sensitive, especially in when the wind blows and there's pollen in the air. And I remember I didn't used to have a problem, but now I need to wear glasses or I need to have some kind of eye protection every time I go out. So, what is happening with aging to the eyes?
I think right from birth, actually, the eye is always changing. So it's already started a process of growing and then also aging. So with time, you lose cells. The ability to regenerate decreases with time. So because I work with children and adults, I noticed a difference in how things are changing. The shape of the eye changes. So
Right.
the optics of the eye changes. So initially, it starts off as it being shorter, but then you have a thicker lens, a more curved cornea or the front of the eye. And as that changes over the first 4 years, you'll get a slightly longer eye and things flatten out. The cornea flattens, the lens flattens. And this process continues over time. And the whole eye, that you've got different layers in the eyes, and these cells and the receptors, the photons, all of these are changing and regenerating. And that's all part of the aging process. So when you mention, changes with menopause, it all comes hand in hand with the aging process. So that's why I thought we'd just talk about aging in general. To go more into detail, you can start off not just the eyes, but around the eyes. So the
Mm,
lids, the skin around the eyes change. So as you,
mm,
the elasticity of the lids change, the collagen changes, and then that's why you start to get sagging of the lids. And often you often get lids which sort of snap,
mm,
as
mm.
you snap back, but
Yeah,
then it
yeah.
starts to droop. Or you have the collagen layers and the elasticity of the lid, and then you start to get a ptosis where the lid
Mm,
drops, or
mm-hmm,
you get your crow feet.
mm-hmm,
That and and even the position of the lids, the elasticity against the eye, that itself can cause a discomfort. So if for instance the lids then start to turn outwards, so the tears accumulate and you get watery eyes. And along with that, also because they're not opposed properly to the front of the eyes and start to get irritable, red, sore, dry eyes. So there are lots of causes for this discomfort and dryness, which we can come into. But just a quick brief, if we start from the front, so the lids get affected. then you can have the shape of the cornea changes. So often people who wear contact lenses might find that their contact lenses aren't quite right, or the glasses need changing. And that can be because the astigmatism changes over time as the corneal fibers change and the thickness changes. So next, if you move further back, then you have the lens. So when you talk about cataracts, so you don't necessarily get cataracts straight away, but you can start to get a hardening of the lens very gradually, and the elasticity of its capsule changes. So its ability to accommodate, to change as you're trying to focus, like a camera lens,
Mhm.
that changes. So that it needs more, you need more effort to try and see and to focus, and that's when you need to change your glasses, or then go into varifocals or progressive lenses. And then that's another big topic, you know. But
I hate wearing glasses. Oh, I hate wearing glasses. I kind of postpone it as much as I can. I know I'm 54 now, and I've been told to wear glasses since I was 48, 49. And unfortunately, the number that was given to me was wrong. And then they said, well, okay, don't bother. And then afterwards, I heard some people say, oh, but if you start wearing glasses, you're going to have to wear them forever. So what is the truth? Does wearing glasses kind of worsen your eyesight? Does it actually make it imperative that you're going to end up wearing glasses forever? Or should you actually try and go without using your glasses as much as possible?
well, I would say you should try and not use glasses while you're still in denial. Okay, which is like okay. So I I yeah, so I'm still in denial, and I try not to use my glasses.
Yeah,
But then there comes a point where you have to use it. Yeah, the further you get away from you're not being able to read, it's a funny one. But yes, I wouldn't jump into straight going for the full prescription, because then you definitely would lose your accommodations. For instance, if you're wearing reading glasses and you take it off, everything is a blur.
yeah,
So you, instead of going for a plus two, plus three, if you start with a minimum, and then it gives you a little bit more leeway in terms of when you're taking your glasses off, whether you can continue without them.
yes.
Um, wearing glasses doesn't damage your eyes. If you need them, you use them, right? So I tell this to children, and I tell this to my older patients as well.
The
So
older children.
yeah, older children, absolutely. So often parents are like, oh, will my child need glasses all the time? So I said, if the child needs to see, they need to see.
Yeah.
And not being able to see actually makes the development of your vision poorer up to a certain age. So likewise in adults, if you need to see, you wear your glasses.
Mm.
And if you don't like glasses, there are ways around it. So like contact lenses, or I wouldn't jump into a cataract operation straight away, but there are different things that you could try.
LASIK. Lots of people. I know a lot of my friends who've had really thick glasses, and then as they've kind of gone into their late 40s and 50s, and I don't know if it's vanity or it's the sudden kind of freedom that comes with income and job security. I really don't know because I haven't had a very detailed conversation. But I find a lot of women, as they go into their mid to late 40s and 50s, they kind of want to get out of wearing glasses unless they're funky, and they will go to a lot of pain, whether it's having LASIK, and spend quite a lot of money. They've kind of saved up money to have laser surgery at this point, so they can go for a few years without having to wear glasses.
Well, that actually it gives them freedom, because now that I'm in the presbyopic age, I know how bothersome it
Well,
is to wear and
presbyopic.
take your
What
glasses
do you
off.
mean by presbyopic? Sorry.
So it's where you need your reading glasses, where your
Right.
accommodation has is much reduced, so you can't really focus on things. So that's what we call presbyopia, which comes with age. So no,
Uh-huh.
it does give you freedom. So
I see.
so initially, yeah, so the advantage of having laser then I would probably say in your 30s or 40s, rather than leaving it too late.
Uh-huh.
The advantage is then you can have it adjusted where one eye is slightly more focused for distance and one is slightly more focused for near. So it's what we call monofocal vision.
Right.
So this can also be achieved with glasses or contact lenses, but then the option of having the laser is very useful.
Yes.
But what you do need to consider is when you're much older, in your 60s, 70s, 80s, when you have cataract surgery, then
Mm-hmm.
the measurements that are taken to plan what lens is being put in for your cataract, to
Mm-hmm.
replace the cataract, is, will change based on the fact that you've had refractive laser. So that must be mentioned to the surgeon before having a cataract operation, because the measurements will otherwise go wrong.
Right, right.
Okay.
Interesting.
So, and how do you know that you're getting cataract? So one, you could get glare. So
Mm-hmm.
while driving, you just start to notice that, things look quite, the bright lights bother you quite a bit. Um, Having to put the lights on,
Mm-hmm.
right? So this can be quite an issue at home, when
Yeah,
when perhaps your spouse likes the dim dark light, and then you come home and then you don't realize, but the dim light starts to bother you. And
yeah,
the reason for that is your lens is hardened. That's
right.
right. And then the contrast changes. So your contrast sensitivity changes. So
Mm-hmm.
you need to have bright lights on. So those are simple things that can help while you're still adjusting to your new sort of vision,
And does the type of
right?
light make a difference? So, all this, I'm reading a lot because I'm looking into longevity and all these kind of things. I'm really watching out for LED lights and like normal lights, whether you use bright white or whether you use warm or whether you use red lights or um, does the light make a difference?
So I think overall, a diffuse white light as a background light is always recommended. So that's good. But it also depends on the time of day. So if your circadian rhythm as well is very important, and
Mm.
especially we've seen during this COVID pandemic,
Yeah,
where we're
yeah.
pretty much on our computers all the time. And the screens have this sort of liquid crystal display,
Mm-hmm.
and in order to brighten that up, it needs a blue light. But
Right.
they combine that with the blue light with a different sort of yellowish photon, but that gets degraded, and then you just have a blue light coming in. So the wavelength, the shorter wavelength of the blue light, comes into the sort of the harmful sort of effect. It's got a high energy visual shorter wavelength, and that can damage the eyes. So it's recommended that you have a blue filter an inbuilt blue filter in your computer. I mean, some people talk about having blue filter glasses, and it's just easier to have it on your computer because you don't need it all the time.
No.
So, and what happens is this light gets absorbed during the daytime. So it's sort of, especially having a lot of screen time. So that then it stimulates the melanopsin, which then keeps you awake.
Mm.
It keeps you alert, keeps you thinking. It sort of simulates the daytime effect,
Mm-hmm.
and then you have sleep problems.
Right.
Whereas in the dimmer light, so if you have warmer lights in the evening, that sort of then the melanopsin is not stimulated, and that allows for melatonin to be produced, which then helps with your sleep rhythm. So that's something that's that yes, the lights do affect you. So warmer lights in the evening, having an hour where all the computers or phones are switched off, or if you do have to be on it, then also have a good ambient light,
Mm.
so you don't have a concentrated blue light glaring into your eyes. And this also damages the lens further, it damages the macula, and it has an overall effect on the skin as well. So
Mm.
with all so it's all about just looking after yourself and trying to be as natural as possible and having lots of breaks.
So a lot of people read ebooks nowadays, Kindle.
Uh-huh.
And I didn't buy a Kindle because I had the Kindle app on my phone and my tablet. And then I thought, hang on a minute, is the actual Kindle a bit different from the app? Because the phone obviously has all these blue light stuff. But I
Mm-hmm.
just think that maybe Kindle Paperwhite and Kindle, the newer Kindles, they're kind of designed for reading without eye strain. How do
Yeah.
people know that they've got eye strain because either because they're reading on a blue screen or they've got eye strain because they've got a problem with their eyes that needs to be checked out? What's the
So that
difference?
Yeah, that's a really good question, because things can get masked. So
Hmm.
another thing I say is a lot of things can get masked or put down to, oh, you've got menopause, so you're having eye problems. Yeah, it's menopause gets blamed a lot for things, but no, you do have to watch that. I think having a regular check once a year with the optician is really important. At least we have in England, it's usually the opticians that have a look where they'll do a thorough check, right? From your vision, they'll have a look at your lens, they check your intraocular pressure, because with age, there's a higher risk of glaucoma with the changes that are occurring. And then they look at the macula for age-related macular degeneration and anything else. So anything that's sudden, you must have it checked straight away.
Red, watery eyes?
Or the ophthalmologist.
Uh,
Okay.
Can you talk a little bit? I mean, as we go through menopause, I talk a lot about women with getting diabetes and hypertension and uh, vascular problems. Many women develop migraines. How does the eye play out in all of these illnesses? Thyroid dysfunction. Uh, what kind of changes do you see in the eye because of these illnesses? And can any of, I mean, I know diabetes and hypertension typically can lead to vision loss, but can you explain a little bit to the audience what do you mean when you talk about, when you say glaucoma? What do you mean when you say macular degeneration?
Uh-huh.
Can you just explain these
Okay.
subjects a little bit, please?
So if we go back to what you first said about diabetes and hypertension, so that's all part of, it's a higher risk, in the perimenopausal, menopausal age, and as you get older. And this affects, this will then have problems with the eye. So it's a vascular problem again. So with diabetes, the blood vessels become a little bit more, the lining becomes a bit more friable. You can get, it's what we call diabetic maculopathy or diabetic retinopathy. Basically, a pathology of the back of the eye due to diabetes. And the blood vessels, you can get little aneurysms on them. You can have bleeds, they will leak, and it causes swelling at the back of the eye, and you can have loss of vision.
Mm.
And the very poorly controlled diabetes, that's why it's really important that if you're diabetic, you must have regular eye checks as well. Because you can catch it early and you can have laser treatment. Nowadays you have injections, you have steroid implant, there are different implants that you can have, but it has to be, you have to catch it early to prevent it. And the most important thing is to control the diabetes.
Mm.
Okay? Also, with fluctuations in your sugar levels, you will also get the sort of blurring of vision, and that's because of the detergence of the lens. So as the sugar levels change, then your
Mm.
lens will swell up as well, and that gives you an intermittent sort of blurring of vision.
Yeah. I remember Khare auntie, Dr. Khare,
Mm-hmm.
Chitra Khare. She used to tell my dad, because my dad was diabetic, and she used to say to him, once you've had your meal, you must walk briskly for 20 minutes, and that controls the sugar levels in the fluids, because the eye's got different compartments and there's fluids in the eye.
Mm-hmm.
Have you seen
No,
that happen? I know.
yeah, yes, yeah. With fluctuation in the sugar levels, yes, your vision does get blurry. Absolutely. Um, and I don't know whether yesterday was it yesterday or a few days ago you had this nice wild fit
Yes. Yeah.
interview, so talking about the head fog as well. So
The
whether
brain
that's
fog.
like
Yes. Yes.
brain fog, whether that's related to that as well, part of it.
Yeah. Yeah.
Um,
Insulin resistance in the brain is
Now,
the cause.
with hypertension as well, the so when it's really true when they say the eye, it's sort of like a window to the rest of your body, because you can actually see inside the eye and you can see the blood vessels. With hypertension, you can actually see the blood vessels thickened within the eye, and there's a risk again there of the blood vessels blocking off, and then you have like a little mini stroke within the eye. So if you notice a sudden blurring of vision, or a sudden, can't see a patch in your field of vision, it's something that's really important to get checked out, because not only the vision is affected, but you could be having a block, or you are prone to getting a stroke elsewhere.
Right.
So that's why it's really important to have that looked at. Okay, or if you have episodes where you have just sort of intermittent blurring of vision, so
Mm.
don't just put it down to, oh, it's just age or menopause. Have it checked out, because it could be sort of like a premonition to having a stroke.
Mm.
Um, Glaucoma, again, you won't. There are different types of glaucoma. So you may suddenly have a really painful eye. It's what we call as an acute angle closure glaucoma. But more often, you would have it where you just don't know it's happening, and slowly your field of vision sort of closes in, and over
Mm.
the years. And that's where, again, you need, so I would suggest if there's a strong family history of glaucoma or loss of vision, you should have it checked from an early age. Have your pressures checked at least once a year. And the glaucoma at a later age is because you get more pigments deposited within the drainage channels, which sort of drain the fluid within the eye. So the in and inflow and the outflow gets affected, and then the pressures go up. So there are drops available, so it's easily treatable, but it has to be checked regularly and treated quickly. What else did you mention? So macular degeneration.
Yes. What is?
Right. So the back of the eye, so you've got the macula, which is the center of vision, which is important for all the detailed the vision and for color vision. And what happens is it's quite the mechanism going on within it is quite rapid. So there's a lot of turnover of the proteins within the macular, the photons, the cones, and the rod receptors. And with age, that can be affected, right? And with when the turnover is affected, you then get the accumulation of lipofuscin, which you can see as little yellow dots. And then that can, sorry, I'm just being interrupted here. And that can develop into, you can either get dry macular degeneration, where it's a very gradual process of where your central vision gets affected. So you start to notice that, you're seeing people, but you're missing out the face. You can't quite see their nose. It's like a little smudge. So if you tend to start, people say, oh, you didn't recognize me, or you're ignoring me. It's not deliberate. Sometimes it's because, no, you can't, with all the masks now as well, and the fogged out, you may not be able to recognize the person. So it's a good idea to just sort of close one eye, have a favorite picture on the wall, and just make sure that each eye is okay. Because you could actually miss having a problem in one eye because the other one's compensating, right? And there's one where you can have an acute, quite an aggressive macular degeneration. So basically, it's a degenerative process where there can be bleeding at the center of vision. And that can be treated. So you can have, series of injections within the eye that can get it under control and prevent it from getting worse. It may not necessarily improve your vision. But if you catch it early, it can. But the main thing is to prevent it from getting worse. And things that you can do to try and slow down this process is just have, that again comes in Wild Fit. One of the things is having a good diet, cutting down sugars, green leafy vegetables, including vitamin C, antioxidants in your diet, beta carotene. And if you're taking vitamins, make sure the vitamins have got vitamin C, they've got some zinc and some lutein in it. So those tend to help with slowing down the macular degeneration and improving the nutrients for the eye. The other important thing that, again, with menopause and with age, there's an imbalance in all the hormones. So there's a change in the thyroid. There's a thyroid imbalance. And thyroid dysfunctions can affect the eyes as well. So often you get initial symptoms could just be simple dry eyes or a lot of blinking. But then you also get deposition behind the eyes, and you get a more prominent eye, wider looking, staring eyes. And it's not just the appearance, but it also affects, so because of the deposits behind the eyes, you can have pressure on the optic nerve. So the optic nerve is where your vision's taken to the brain, and it's then read by the brain. So any chronic sort of problems, it's important to, again, just get your thyroid functions done along with diabetes and blood pressure checks as well.
How frequently, you said every year we should get our eyes checked?
I think once a year, say above the age of...
If you don't have any problems, just get a checkup once a year.
Just get a check, yeah. And in between, just have nowadays, the other thing is part of what I'm interested in is apps, the free apps. You can have a vision app on your phone. And for macular degeneration as well, you get the AMSLA chart, which is like a little square box with little mini lines on them. And then you just focus on the center and just make sure that all the lines are straight. So if there's any sort of distortion or patches missing in that, you know that something's wrong with your macular central vision, and then have it checked out. Um, and often another thing that sort of happens with age is because things are changing, the eye is filled with a jelly called vitreous, and that the jelly becomes a little bit more fluid and
Mm-hmm.
a little bit more mobile. So it's if you imagine a ball filled with some jelly that's stuck to the back, and then with time as it gets loose, the parts that are stuck sort of get pulled out.
Mm-hmm.
And what people might notice with time is floaters. So often
Yeah.
you get, yeah. So these are floaters that you can see, in when you're looking against a plain background,
Mm-hmm.
and have it checked out anyway, because what can happen is as the jelly's coming loose, you get the floaters, which are fine. They're not usually bothersome, or you learn to live through it. But
Mm-hmm.
if the thickened jelly as it comes off, if it pulls on the retina, you can end up with a retinal tear or a retinal detachment,
Okay.
especially people who are short-sighted or myopic. So they have a higher chance of having a retinal tear or detachment. So any sudden appearance of floaters or flashing lights is something that must be looked at, and they
Mm-hmm.
need to have a dilated fundus examination for
Right.
that.
And do people who had injuries earlier in life, so how well does the eye recover from blunt trauma injuries? If you haven't needed surgery, how quickly does it recover? And does this recovery time change as you age? Um,
Okay.
I'm asking because my sister-in-law had an injury to her eye when her daughter kind of kicked her eye,
Okay.
and she's continued to have problems with it. I'm just wondering, what care does she need to take as she goes through menopause?
Right. So it depends again what sort of injury she had. So you mentioned it was a blunt
Blunt.
injury.
Yeah.
Right. So again, the impact. So how hard was it? Like, sometimes I get people come in with a football injury,
Yeah.
or a squash ball. I would say is more deadly than a football or a
Yeah.
tennis ball, because it goes right against the
Yeah.
eye.
Yeah.
So what happens is when you have any blunt injury, it kind of compresses the eye, and the
Hmm.
eye bounces back.
Yeah.
So there's a lot of shift. So things can be shifted back. So things can tear. The iris can tear off, or you can get retinal detachments. So it's any sort of significant blunt injury, I would have it looked at, right? And also you can get scratches, what we call as abrasions on the cornea or the
Mm.
front of the eye.
Mm.
And what can happen again with menopause aging is that you get dry eyes,
Mm.
and any sort of abrasion, although it heals, because of the dryness, there's an increased chance of it ripping off again. So you might all be settled, and you wake up first thing in the morning because your eyes are closed. You lift your lids open, and it rips off the epithelium or the layer
Oh,
that had healed up.
wow.
It's almost like a tear in paper, and then you stick it with glue,
Yes.
but it's still not the same as what it was.
Right.
So with aging, the dry eyes is an issue, right? So and then which is multifactorial. So you have the environmental factors because of dry eyes, the wind, the heat, and there's because of the hormonal imbalance.
Mm.
The hormone, both in men and women, it's common to have dry eyes as you get older, is because the tears which are formed by, one is the tear glands, which is the watery part,
Mm.
and then you have the lipids, or the thicker lipids that are secreted by the oil glands. That's reduced, and
Mhm.
that seems to be sensitive to, they've got androgen receptors. So in the
Ah,
males and females, and more so in females, the androgen goes down,
yes.
and so the lipid layer that's formed by what we call the meibomian glands is reduced.
Hmm.
So that is what stabilizes your tear film. So if the
Right.
oil gland is reduced, then your oil layer is reduced. And the third component of a tear is the mucin. So you've got the
Mm.
cells within the inner side of your lids.
Yes.
Uh, and that's all. So these three components make a thicker layered tear film. And if that's not stable, it's almost like water on a window, when it rains and you get
Yeah.
little droplets.
Yeah.
So rather than a nice clear film, you get the droplets there, or the tears break up, and then your vision goes blurry.
Right.
So blinking more often, and there's a lot more I can talk about with dry eyes. It's like you've got dedicated dry eye clinics that you can have.
So
Um,
give us a glimpse into what you would recommend to menopausal women who experience dry eyes. And I am supposing that just because somebody goes through menopause and the hormone levels eventually settle down, that the dry eye actually doesn't get better. Pretty much like vaginal dryness doesn't get better. It tends
uh-huh.
to just continue getting worse. So do dry eyes also continue to get worse as you age?
It does actually, yes, because one is like the cells go through a process of um, uh, apoptosis, or where where they
Mhm.
can't regenerate and then they die off. So similarly, the glands get reduced as well. So
Mm.
dry eyes can be a constant problem, and that can also cause the sort of just the discomfort of your eyes,
Mm.
the fact that you're finding it having to blink a lot more.
Yes.
Uh, at computer time as well. I just wanted to add this in because it's really important that what a lot of people working on the computers tend to have a lot of dry eyes, and one of the
Mm.
reasons is the blink rate goes down,
Right.
right? And a little trick that you can do is just have your laptop or computer put at a slightly lower level. So you're
Uh-huh.
having to look down. So
Yeah.
when you look down, your lids automatically come down,
Okay.
and then
Like that.
you blink better. Whereas if it's higher, you end up staring with,
Yeah.
with your eyes wide open, and that dries the tear film. So that's just the computer thing and take regular breaks, right?
Yeah.
So the other thing for dry eyes is to get these glands. So the glands are just sitting just behind where your eyelashes are. So
Mm-hmm.
they're got multiple glands along the upper lid and the lower lid.
Mm.
So warm compresses. So maybe twice a day. If you think you're getting sort of tired, dry, irritable eyes, one of the elements is the reduced tears. But you could also have a mild inflammation. So anything that dries up, you could have a little inflammation along the lids, but the treatment would be pretty much the same. So initially have warm compresses. There are lots of YouTube videos, but to put it simply, have a bowl of warm water, dip cotton pads in, then just hold it over your eyes for about a minute, and that will open up the glands. So it'll soften the oil that comes out of the
Mm-hmm.
eye. You can also do a little, what I call a little massage or a squeeze, where you're just squeezing all the glands together like
Mm-hmm.
that.
Mm-hmm.
And then you clean the lid margins. So
Mm.
you're getting rid of all the grit or the thickened oil that's stuck there, which can go into the eye and irritate it. So it
Mm-hmm.
actually scratches and irritates the eye.
Mm-hmm.
And a simple thing, I call it your daily beauty treatment,
Uh,
is just twice a day, warm compresses, a little massage and clean should help to just keep the oil glands flowing.
mm.
And flaxseed is supposed to be very good. If you include flaxseed in your diet, it liquefies the oil glands, and this also has an anti-inflammatory property. So just simple things for your eye health. Mhm.
What is the role of all this stuff that, like cucumbers and papaya and putting aloe vera gel and all these kind of herbal stuff? Do they really have any kind of role?
I don't know, but I still do it because it feels nice. So it just feels nice. So I don't know the medicinal property of it, but if it cools and it calms, then why not? Um, but
Does it do
additionally, you
any
can
harm? Does it do any harm?
it doesn't do any harm. It's only on the surface of the eyes. You're not putting it in the eye. But if you did want to calm the eyes, you do get artificial teardrops.
Yes,
And if you go for artificial teardrops, I would suggest ones without preservatives. So look for preservative-free teardrops,
right,
right? And then also there's a wide range out there. So just make sure that you know how it's meant to be stored, how long you can keep it for. Is it just 28 days, or is it the ones that you can have more for about 3 months? So just you must throw them away, when it's meant to be thrown away. Otherwise, you'll end up collecting bugs within the eye,
right,
within the bottle, and then you're actually getting yourself into a situation where you get repeated eye infections.
right, right.
So that's something that,
That's really important,
mm,
checking, because I think the worst thing is to lose vision. I
yeah, absolutely.
I think with my dad particularly, his vision in one eye is going, and I kind of look at him and I think if he loses his binocular vision, which he is losing, it makes going up and down stairs really difficult, and the risk of falls increases as people get older. So
Absolutely.
yeah, and I know a lot of people also talk about glasses. Yeah, those the new glasses. When you get new glasses, they say, "Oh, be careful when you're going up and down stairs."
Mhm.
Uh, what are some tips to help people with new glasses? How should they adjust to new glasses? I know you said you should start with a lower number, but when
Yeah.
sometimes I know I've recently started to need to go for cesareans, and I find that if I use my glasses, it's just not right, and if I
Mhm.
don't wear them, I can't see the fine bits. So I think I'm gonna need the ones where there's a changing. number. So
Yeah.
you move
So
your
the
head like this and look from the top, then look like this, look through the bottom.
Yeah, so those are they're called varifocals or progressive lenses. So
Yes,
basically,
yes.
you've got your distance prescription, and then you have the intermediate prescription, and then you've got your near one. So it saves having to either change, just having reading glasses and changing. So it gives you what you were able to do with the focusing of your lens, you can't do
Mm,
now. So the progressive or the varifocal lenses have got a series of lenses in them for distance,
yes,
intermediate, and close, but they can be tricky. They're very expensive.
yes.
But people who get used to them will then like it. Otherwise, you notice that sort of blur in between each area, and it can be you can have a bit of imbalance. So it takes a while for you to get used to.
Mm.
If you do get varifocals, have an understanding with the optician that you may need to come back if you haven't adjusted to it. You may need to change it, and you will need time to adapt into it.
What sort of reasonable time to give yourself to adapt to such glasses?
I would probably give it at least, if it's tolerable, at least 4 weeks. If
Okay.
it's not tolerable, I'd go back. I'd go back the next week if it's
Yeah.
like, way out, right? Because it's the fine adjustments that need to be checked.
And
I
is
mean,
it
the
quite
other
normal to get headaches? Like lots of people complain of headaches when they have new glasses. Are
yeah,
headaches a component of the glasses, or is it something that people are gonna get anyway when they start changing?
I think you will start to get more headaches even before when you need a change of glasses,
Right.
right? So you've got the eye strain, so you're trying, so you are accommodating, right? So you're using all the effort you can to see,
Hmm.
and that itself can cause eye strain or
Right.
fatigue the eyes and strain. So as a matter of fact, when you start to wear glasses, the headaches might be relieved.
Okay.
But if you have an astigmatism where the axis of a particular part of your lens is different,
Hmm.
and it's not quite right, then that could be a reason for your persistent headache. So something in the glasses needs adjusting.
Right.
Right? A simpler way in initial phases are if you just want to have just separate plain reading glasses, right? And then when you're looking in the disc, you just wear it lower and then just look over your glasses with that very knowledgeable
The
look.
headmistress look. Yes. What can I do for you?
So that's
It reminds me of school.
well, I have to admit, I have to confess that I just buy over the counter reading glasses, even
Okay.
though I'm an ophthalmologist.
Yeah.
Uh, I haven't been to the optician yet, but I will at some point. But I just go and pick up a plus 1.5, but I just make sure that they're clear, no scratches. And if it doesn't help, then I'll switch over to probably varifocals. The
Hmm.
other option is bifocals,
Right.
where you
Yes.
have, there's a lower segment which is for reading, and then the upper segment is for distance. So if you
Yes.
need a distant prescription, then you would obviously need to have bifocals. Or easier still, just have separate pairs, one for reading and one for distance.
Yes. One for driving.
Another trick is to use monofocal. So you can adjust the lenses where one eye is for distance, one is for
Ah.
near,
Okay.
right? And for those who don't want to wear glasses, you can try that out with contact lenses.
Very recently, I can't remember where, I was seeing an ad about these glasses where you got a little adjusting screw or something on the side and you can twist it and it
Okay.
changes according to what kind of number you need. Have you seen that?
No, I haven't actually. Where is
I
this?
don't know,
Okay.
somewhere on the internet or in a magazine. It's like a new development where you have these special glasses where you can twist something and it'll kind of adapt to the vision that you need at that time. Because I'm just presuming that when just like blood pressure and just like blood sugar, when you go to the optician or the ophthalmologist and you get your number checked, it's probably right for that moment in that particular room, in that particular condition. And because of the changes that's
Yeah.
happening in the eye, your number probably, your ability to focus and accommodate probably does change throughout the day, and what kind of environment you're in, what you're reading, what kind of light you've got, etc. So I would actually, that was quite an intuitive thing for them to develop. I was quite surprised that it's actually, it's there in the
I
market. It might be
I
pretty
have
expensive.
I haven't I'm not aware of this, so I'm going to look this one up. Right.
Ah,
But you're not referring to the photochromic lenses, are you?
no, no,
Where
no,
which
no,
sort of
not for
adapt to light?
photochromic, it just changes light. No, no, these are actually
Yeah.
the spectacles that you can twist a knob or something on the side, and the magnification changes. This is
Okay.
the first
Right.
time I
No,
saw
I didn't
them.
know
I
that.
thought it was something like, what was that, Google Glass or something. Then I read the ad carefully, and it was about glasses, actually spectacles. So interesting. Need to look it up.
Okay.
We have another
Absolutely.
conversation about that. So I wanted to
Yeah.
also talk about sunglasses because
Okay.
I had a friend in the UK who used to always tell me, always wear sunglasses, don't go, because sun damage is really, really a big
Uh-huh.
problem. And I suppose in a country like
Uh-huh.
India, where this, especially now in the summer, I go to take Diego out for a walk in the morning, and even then, I'm really wanting some sort of shade, and the
Uh-huh.
light can be just too bright and I can get a headache with going out in the sun.
Mhm.
So what kind of sunglasses do you recommend, and is this theory right that the sun damage is prominent? What sort of time of day,
Yeah.
or is it just
Yeah.
dependent on you? Do you get bothered so you wear sunglasses, and what's the quality of
So yes.
sunglasses?
Yeah. So any brightness is going to bother you if it's kind of hitting you in the face. But what's more important is the ultraviolet light.
Right.
Okay. So what you need is whether what no matter what type of sunglasses, they could just be dark glasses, and that's all that's doing is cutting out the light
Hmm.
or the glare. But what you want is something that will absorb the ultraviolet
Right.
rays and prevent that. So the damaging one are the ultraviolet rays, and is the high energy visual blue that you get.
Right.
So but yeah, so that's the main thing. I mean, there's a range of sunglasses that you can get, but this is the main thing. And even the sun here in the UK, although it's not always that sunny, we don't get the sun out that much, but it's the ultraviolet rays that damage.
Hmm.
So so just like you get skin cancers, it's all the damaging effects of the ultraviolet rays. And
So,
you do get lots of macular degeneration that develops with that. So it's important. Hmm.
and does I suppose the price range matters. How much should we be spending on glasses, spectacles or sunglasses? Because I suppose with glasses, and I remember the first time I tried to get glasses, and the number when and I ended up going full out, and I spent, well, in Indian rupees, I spent about 17 or 18,000 rupees, which was like way over the top I'd ever imagined spending on glasses, and they were all wrong, so they're sitting in the cupboard now. And I think the most I've spent on sunglasses has been anywhere between maybe 4 and 5,000 rupees, and I suppose Ray Bans will go up to 10,000. So,
Mm.
what is a good average spend? Now, what kind of spending do you know that you're actually getting the bare minimum quality that you need? And is it really that necessary to spend extra
Yeah.
money on getting Crizal lenses and those blocking films, and how much should you go full out in terms of spending money? Does it
That's
actually
it's a
add up to a
difficult one.
benefit? Does your
Yeah.
spending actually give you that measure of benefit, or is it just, is there like, after a certain time you've got a, like, no returns, actually getting the returns for the money you put into it?
Uh-huh. That's an interesting one. One is I'm not a brand person, so so I wouldn't go by the brand. And another thing is I end up coming to India to get my glasses because they're a lot cheaper.
Yeah.
Okay. So it just depends on what you're comfortable with. As long as it's someone you trust, someone who's reliable. The tricky part comes in when you need a prescription and then you want to have your sunglasses made in that prescription.
Right.
So it will be expensive. I think up to 5,000 rupees is probably reasonable, but it just varies. It varies from optician to optician. So I would suggest shop around, make sure that they're making you a good pair, and I don't think you need to go in for anything too expensive. As long as it's cutting out the ultraviolet rays, that's probably the most important thing. And as long as you're not doing direct sun gazing,
Mm-hmm.
which is the other thing. So I it's variable. It's very difficult to say. It depends on how much you want to spend. I would say spending extra uh, isn't really going to make much of a difference.
Mm-hmm.
Just make sure that the ultraviolet protection is there.
Because with Polaroid, I know one thing. I just noticed this. I bought Polaroid sunglasses, and they particularly help me at night when I'm doing night driving. If I wear the sunglasses, the glare of the oncoming
Uh-huh.
cars is much lower. So I'm actually wearing sunglasses in the car when I'm
Uh-huh.
doing night driving. But what I've noticed with particularly with Polaroid sunglasses is that I can't see the phone screen then.
Uh-huh. Yeah. Yeah. I know that's a tricky one. Yeah. And then because again you're losing contrast. So
Right,
when you're wearing something that's the Polaroid or darker glasses, you lose contrast.
right.
Uh, Another way of helping is then to have better ambient light,
Yes,
right? So it's mainly for outdoor use. So when you're outdoors in the bright sun, that's probably when it's the most useful. And then again, while driving to get rid of the glare. Mhm. I,
wonderful.
I just wanted to touch base on a couple of other things in terms of double vision. So
Yes.
like I was saying, this you have your collagen and then your elasticity and then the muscle tone
Mm-hmm.
decreases with
Mm-hmm.
age. And what often especially my practice, because I deal with a lot of squints, is you have older people that suddenly come on with double vision,
Yes.
right? And that's because there are a couple of reasons. One is it could be a nerve problem or a
Mm-hmm.
brain problem, or they could have an inflammatory problem, what we call giant cell arthritis.
Yes.
So I wouldn't just put it down to aging, right? And with aging, you can get that because they may have had a little bit of a squint, which they're able to control,
Mm-hmm.
either with a head posture or they've just be adapted to it. And then with age, the change in the muscle tone, they are unable to do that anymore. So they've just decompensated. So
Right.
that's fine. But I still think they need investigating because you could be sitting on a tumor, you could be sitting on an aneurysm, or you could have diabetics you can have a third nerve palsy with diabetics, right? So it's important that if you have sudden onset double vision, especially above the age of 50 or 60, you
Yeah.
must have it investigated to make sure you're not sitting on an aneurysm time bomb.
Yes. Yes. So sudden. So things like the things we've covered. That you talked about double vision, sudden painful eyes, sudden loss of vision or change in
Yeah.
vision,
Uh-huh.
um, and we talked about the illnesses like diabetes, hypertension, thyroid dysfunction. We talked about cataracts and glaucoma. We
Mhm.
talked quite a bit about glasses, spectacles, and what kind of numbers to use. We talked about sunglasses. We've
Mhm.
talked about light damage and sun damage to the eye, including blue light damage. And what else did we talk about?
Another
Talked about
important thing,
dry eye.
dry eye. But another important thing is smoking.
Ah,
Smoking is
yes.
very, very damaging. One is especially for if you have thyroid, just stay away from smoke. Thyroid problems, the smoking will aggravate it, and macular degeneration is aggravated by smoking as well.
Mm-hmm.
And I think,
No,
the eyes basically they tell you what the body's doing. So you
yes.
have, controlling your diabetes, improving your health, improving your nutrition, watching your blood pressure, reducing stress levels, all of that will also, improving all of that will also improve the health of your eyes.
I remember I wanted to ask you about eye exercises. So
Mm.
what do eye exercises achieve? I mean, we see. I mean, a lot of people we look at Baba Ramdev on TV, and since I was a kid, we've been doing the eye exercise of moving your thumb back and forth, rotating your eyes, taking a break and looking at the distance, looking at something green. So, what's the importance of continuing to do eye exercises as we age?
Well, I know there's a lot of yoga practices with eye exercises, and I have a friend who might be listening in, and she's a yoga teacher, so I'll have to ask her the exact details. But I think apart from keeping the eyes supple, I'm not really very sure. But they say the finger move that helps with focusing, so you're
Hmm.
kind of still keeping your accommodation and you're focusing,
Yes.
right? And then the different positions of moving the eyes is just to keep the muscles going.
Hmm.
Like for the younger children, we would we have the people who where the eyes have a tendency to go out, we get them to focus in so that their
Yes.
eyes come together. And for those that have a tendency for the eyes to turn in, you kind of relax the eyes so the convergence or the intern sort of relaxes.
Mhm.
It's just sort of trying to adapt to the muscle tone. But the scientific basis of it, I couldn't tell you. That probably have to be a talk of yoga and menopause.
Right. Okay, great. And I'm just checking if I've left anything out. So we talked about the eye, aging, menopause, different decades, cataracts, glaucoma, painful eyes, circadian rhythm. I think we've addressed most of my questions, all of my questions. So, are there any particular tips you want to give women before we conclude? Um,
I think just if you stick to the little beauty regime I said with the warm compresses and the cleaning, it'll just keep your oil glands and your tears, functioning well. Um, and if there's anything unusual, not really red eyes that haven't settled, it could be an inflammatory process. If you're getting a dry mouth as well,
hmm,
then something like Sjogren's syndrome,
yeah.
or an autoimmune condition, where you might need steroids or further
Mm-hmm,
treatment. So anything that's not quite settling down, have it checked out.
mm-hmm,
Have once a year check to make sure that your pressures are okay, so you're
mm-hmm,
not developing glaucoma, which is a silent blinding condition.
mm-hmm,
um, and then just check your eyes, ever so often, just check one at a time, because things like you could suddenly develop a macular hole which can need treating.
yeah.
And then you could just download a vision app on your phone. You get
Ah,
these free vision apps.
okay.
Yeah, just go into your app application and just check your near vision, check your distant vision. And while we're still in lockdown there, at least that's a good way of making sure everything's okay. Yeah.
Wonderful. That's absolutely fabulous. Thank you so much for talking to us.
Thanks
So,
for the
what is
opportunity.
new for 2021 for you?
Ooh, so I think COVID and this, I'm actually in quarantine now.
Yes.
This has given me new sight, as I would say, or a new vision.
Philosophical
Yeah,
vision.
yeah. So I'm looking at, so apart from, what I do as a profession, I'm just looking into, making the most of life. So I'm like more getting back into creative writing, a bit of, a few voiceovers, get back onto the creative side. And the other thing is I really want to take this nonprofit initiative of Sight and Beyond a bit further. So I just want to reach out more.
Mm.
So for those who are visually impaired, so I would just want to make sure that I can get the website up and running. And I have been doing little workshops, but now with internet and Zoom meetings, I could probably reach out a lot more. So taking Sight and Beyond a bit more globally, so I can reach out to the visually impaired.
How should people get in touch with you for Sight and Beyond?
So we have an Instagram page. If you just put in Sight and Beyond, all in words, and then, or you could email me on sightandbeyond@aol.com.
Mm-hmm.
And if there's any sort of vision issues or concerns, it's just more of information, providing information, and you're pointing you in the right direction. Be happy to help there.
Wonderful. Thank you so much for coming
Thank
and being a
you,
guest.
Nilima.
I'm just going to take a minute and see if anybody's asked any questions on our Facebook group. Uh, and if we need to answer any particular comments. And I think we are good to close.
Wonderful. Thank you, Nilima,
Wonderful.
for this
Thank you so
opportunity.
much.
It's
Bye
actually
bye.
been eye-opening to me as well.
Bye bye bye.
Thank you.